That's why they spelt out VET instead of saying it. Clever. Oh well, I always get treats when I'm here anyway. Oh, hello.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
She's so beautiful. Do you have a quick check over?
Known as a nation of animal lovers, the UK is home to 36 million household pets. 12.5 million cats, 13.5 million dogs, and not to mention all the other creatures, great and small, that we welcome into our families.
And in this new series, we'll be finding out what happens when our fur-legged friends are in need.
I'll meet their devoted owners and the expert staff who treat them. From the routine...
Emergency Ward 10, I'm your girl.
...to the life-saving, and everything else in between.
I could sit here all day and talk to these doggies.
We'll capture the intense bond between owners...
Hello, darling. Hello, sweetheart.
...animals and the vets.
I love you too, yes.
And we'll meet the working dogs given a well-earned second chance at life.
There's a good boy. It's just a wonderful feeling to see those dogs go off to new homes and new families.
So, join me, Fern Britain, on a roller coaster of emotions inside the vets.
Husband and wife team Andy and Amy Valencia met studying veterinary science in Bristol 17 years ago. And it's here, in the pretty Edwardian suburb of Henlees, that they chose to build their home and independent veterinary practice dedicated to the needs of the local community and their four-legged friends.
Oh, look at you.
Veterinary surgeon Dr. James Greenwood works closely with Andy and Amy. Their friendship and working relationship first established back in their student days. Together, they have welcomed me behind the scenes to join them and their dedicated nursing team to see firsthand what it's like to be inside the vets.
They are so cute.
On a brisk spring morning in Bristol, owners are lining up at the vets, here for vaccinations, checkups, and a little reassurance that their beloved animals are in the very best hands. Come on. The first appointment of the day, however, happens to be outside the consultation room with Labrador Bailey.
Let's give it a go again.
Okay. Come on, Bailey. Come on, buddy. Good boy. Bailey's been reported by his owners to have a bit of a limp in his walk. And so Ella is walking him up and down with Andy, watching and observing to see which limb or limbs are being affected.
Bailey is 8.5, he'll be 9 in June. I've always described him as an Oxbridge candidate. I think he's very intelligent. We've had Bailey since he was 8 weeks old. I've had labs now for over 20 years. I genuinely believe that the dogs are pack animals. These two dogs absolutely adore each other. They play all the time. Typical Labradors would eat the shoes off your feet, but Bailey is so well trained that he will wait to be given food. He's very smart, he understands me, he's very gentle, very kind, and very, very supportive, will follow me everywhere. I'm pretty tough with my dogs. I like them to be well trained. Every walk is a training opportunity is one of the phrases my children laugh at.
Labradors are particularly prone to arthritis, a progressive breakdown of cartilage within the joints, with symptoms often worsening with age.
In January this year, we noticed suddenly that he was limping from the moment he woke up and got out of his bed in the morning, just literally to walk from one room to the other. We knew there was something wrong.
Let's just do one at trot.
Yep.
I'm discovering that veterinary medicine is detective work, a constant process of investigation and piecing clues together. The next step is to continue Bailey's diagnosis inside the vets.
We looked at the way he was moving and we could see quite clearly that he's laying on this right forelimb. So obviously if he was a person, we would just ask, but we can't ask him. So unfortunately, what we're going to need to do is carefully and systematically work our way up the limb and give things a bit of a squeeze and move it a bit and look for a pain response.
Okay.
So Amy's just going to hold him still for me.
So you're testing his toes?
So I'm squeezing his toes, I'm looking for a pain response. So there's a little bit of a swelling within his paw there. I'd say that is a pain response. That knuckle, so to speak, feels quite thickened, so that's certainly something we're probably going to want to x-ray. So now I'm just manipulating his, what we call his carpus, so his wrist joint. Ooh. So unfortunately, we're having to be cruel to be kind in this situation. So now we're moving up to the elbow. Now, being a Labrador, this is where I would expect the issue.
The Labrador's elbows are...
They suffer with a condition called elbow dysplasia.
This is a developmental disorder of the elbow joint where the bones fail to align correctly. It can lead to pain, lameness, and, over time, arthritis, a common issue in larger, fast-growing breeds, like Labradors.
Let him just shake it off. He's a bit fed up, which is completely reasonable.
Yep.
We're not going to get much more that we can interpret. I'm only 50% convinced that the problem is definitely his elbow. I can't say this for certain, but he's likely to have a degree of arthritis secondary to this thing called elbow dysplasia, which we then have to figure out how we're going to manage it. And it might be things like physiotherapy and hydrotherapy.
Yeah.
There's also things we can do specifically at the level of the elbow. Things like cortisone injections.
Yes.
And then there's also stem cell therapies that we can consider as well.
He's settled quickly, hasn't he?
Yeah, Amy the dog whisperer.
So it's a good time to have some pet insurance.
I mean, we're in a situation where we don't quite know where this investigation is going to lead. And it might be a quick fix, or it might be a lifelong condition that we're going to be managing for him. And yeah, that can get expensive.
While I stay with Bailey, in the next room, Vet James is getting ready to examine Bamboo, a mature rabbit who's approaching 11 years old.
Hello. Come on in.
Thank you.
Bamboo belongs to veterinary nurse Ella, who's brought her long-time companion in for a routine annual checkup. A vital part of preventative care, especially for senior pets.
It is nice to bring your own pet to work. I can be there with him, so that's a perk of the job.
How is lovely Bamboo doing?
For a nearly 11-year-old rabbit, it's not doing too bad.
It's fantastic, isn't it?
Yeah.
I think he's possibly one of the oldest bunnies we've got on the books.
Yeah.
11 is definitely...
We'll take that, won't we,
It's
Bamboo?
a great age.
He's a very special boy to me. He has been with me for a long time now. I got him when I was 16. I did some work experience on a farm, and I couldn't leave said farm without him, basically, so he's been with me ever since. There's something a bit strange going on.
Yeah, he's got a few little nodules over his nose, hasn't he? We'll do the consult on the floor so that he stays nice and chilled. A few things that we're looking out for in healthy bunnies. First of all, we're looking for a nice clear nose with no snot, with no sort of discharge, no snuffles. Sometimes bunnies can get a very creamy, quite sticky discharge coming out of their eyes, which is then obviously a sign of an infection. Skin-wise, we want to sort of see a nice healthy coat with no bald patches, no red patches, nothing that's too itchy. Okay, right, let's just have a little listen to his chest as well. That sounds clear. Is he passing nice, regular, firm stools?
Yeah.
Yeah?
Yeah.
Okay, so the next thing we need to somehow do will be just see if we can have a look at his teeth.
Mm-hmm.
Rabbits' teeth grow continuously, up to 2 millimetres a week.
Oh, you're being very good.
Without the right diet to wear them down, they can develop sharp spurs or overgrowth, leading to pain, abscesses, and difficulty eating.
He's not got any spurs. They look great. And then lastly, it's looking at his back end. Sometimes they can get poo stuck to the fur, and that can attract flies to their skin. And if flies lay, well, we've seen it a few times, haven't we? If flies lay eggs, leads to maggots hatching out, and that's called fly strike. And that very quickly can become an emergency, which is obviously not pleasant for anybody. Great, and his hocks are nice and clear. Yeah, good.
And you can see some of the soreness on his feet.
Yeah, so he's obviously licking his front feet a little bit there, isn't he? I know we've treated him for all sorts of different things, trying to rule out things like rabbit syphilis, rhabdomatosis, parasites. But he's had that now for nearly a year, is that right?
Yeah.
Another possibility is a viral infection, because he's got a few little lumps through his ear there as well, actually, hasn't he? So sometimes rabbits will lick their paws or lick their feet if they have got arthritis and it is actually a pain thing. So it might be worth us maybe seeing whether we increase his pain relief, possibly repeat the anti-parasite treatment. Okay. Again, we could potentially trial the course of antibiotics in case there is a secondary skin infection. Sure. We don't want to rush to do stuff unless we really need to. Should we get a weight on him as well?
Yeah.
Let's see what he's weighing. Great. Right, 2.24. Let me just pop that on his record. So we can certainly put you up some more medication.
Yes, please.
You're doing really well, aren't you?
Thanks, James.
Okay.
While Bailey and Bamboo are learning to take life a little slower in their later years, one much younger patient is just getting started. Etty, a Hungarian Vizsla, has been visiting the vets since she was a playful pup. And today she's in for a final checkup before keyhole surgery.
I decided to get Etty spayed because we definitely don't want to have puppies. The vets here and the nurses are just, they're so wonderful. They're really caring, and you know what? I never worry about dropping Etty off here. I completely trust them.
She is so
She's such a good
pup. You are. How old is she now?
21 months, so she's June.
Okay, and how many, has she had one or two seasons? Great. And when was the last one?
Ended in end of October.
October, November, December, January, February. Perfect. She's not getting interest from the dogs. Today is more to check for any sort of false pregnancy signs as well, which by now I'm pretty sure you would have spotted at home if we were anything to worry about, but good girl.
As well as looking for signs of a phantom pregnancy, James will carry out a full checkup, an important step before any animal undergoes a procedure that involves anaesthesia.
Good girl. Can I see your teeth? And how is she in herself at the moment? Are you happy that she's really well?
Yeah, really well.
No vomiting, diarrhea, eating, drinking, all's normal?
Eating, drinking is normal.
Brilliant. Good.
No issues from my side.
Yeah, is that better? Is that what we needed to do? Is that what we needed to do?
Oh,
Hello.
you got a full Vizsla. I'm sorry.
Hello,
this is
baby. Oh,
very Vizsla thingy.
You are very adorable.
You are.
Right, let's have a listen to her heart, if she will.
What's that? Sorry.
I do need to just have a little feel of her glands.
Yeah.
So we'll just see if she'll let me do that. Good girl, it's okay. Good girl. Right, beautiful. So she doesn't feel like she's got any sort of false pregnancies. Timing-wise, it's perfect. Heart sounds lovely. She's obviously nice and fit and healthy. We'll have another listen to heart on the day of the surgery. Right, great, lovely. We will see you on the day.
Coming up, we meet the heroes giving vulnerable dogs the fresh starts they so desperately need.
Every dog that leaves us, we've given a second shot at life.
Visit the globe-trotting cat who's racked up more air miles than the average holidaymaker. And I scrub up for surgery.
Wow, what a piece of kit that is. Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Uh-oh, vet bills. Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Nearly 1 in 3 households in the UK now owns a dog. That's more than ever before. We're a nation increasingly shaped by our canine companions.
How old is she?
She's 15 weeks.
Oh, so she's very young.
Yes.
And with that love comes responsibility and investment. The UK's dog owners spend an average of £1,800 per year per dog on food, vet bills and insurance.
You never know with any pets that you have what health issues are going to arise. We're insured with Pet Plan. Oh, I love them so much. They're wonderful little dogs. They are literally one of our family.
What are you feeling for him?
So I'm sort of feeling the shape of his liver, feeling the sort of shape of his spleen.
And for many of us, they're not just pets, they're family.
Good boys. Good boys.
Claire has been a devoted mum to Bailey for the last 8 years.
Bailey is my third child, but Bailey is more than that because he's been an absolute rock through the last 8 years of my life. So in those years, my children have left school, they've gone to university, I've been through a divorce, and the one person who's been there all the time is Bailey. It's a partnership, and he is my rock. I will do anything for Bailey.
Bailey is being prepared for X-rays by vet Andy to see if he can locate the source of the problem for this well-loved pooch.
Okay, X-rays, priming, taking.
Vets use X-rays to help diagnose problems like broken bones, joint issues, and internal illnesses across a wide range of animals.
Can you just pull the X-ray up for us?
To get a clear picture, patients need to stay completely still. Even the slightest movement can blur the results. That's why sometimes sedation or even a light general anaesthetic can help.
Right, let's get him on his left lateral now.
Yeah.
I'm gonna just do it on the big plate, I think. X-rays, priming, taking.
So the results of Bailey's X-rays are in.
So we've X-rayed the good limb and the bad limb so we can compare the joints. If you look along this edge, there's all these kind of sharp little shardy bits. It's got a big knobbly bit of bone there, which shouldn't be there. What that means is bits of bone are going to be rubbing on other bits of bone, and the cartilage is going to wear away. And once that happens, you get an inflammatory process. And once that inflammatory process starts, the body starts doing slightly silly things, like laying down new bone growth. We can be pretty convinced that the main issue is right elbow inflammation. It fits with what we saw on clinical exam, and the X-rays are pretty clear there.
As with humans, arthritis can be painful for our pets, causing stiffness and inflammation. It's estimated that 1 in 5 dogs in the UK suffers from arthritis, and Labradors are particularly prone, especially as they reach their senior years.
Does that mean his pain has been bad for a long time?
The process of arthritis has clearly been going on for some time, but it doesn't necessarily mean that he's been in pain this whole time.
So his owners didn't do anything wrong? They didn't leave him in pain unknowingly?
No, absolutely not. That's the thing to say. Arthritic changes on X-rays don't necessarily mean that that's the source of the problem, which is why we spend so long doing that pain investigation. If you only looked at X-rays, or if you did the X-rays first, you can get absolutely veered off in the wrong direction.
And his little knuckle that you were pressing that was painful, there is a sign of arthritis
there is a sign of arthritis there too.
Yeah,
so
as we're all getting as we get older.
Absolutely. We're going to do everything we can to bring that baseline level of pain down.
What is the treatment?
What I would say is there's never a one-size-fits-all approach. What we want to do is make sure he has as much good quality, happy, enjoyable life as we can. This is going to be a progressive condition. We're going to be using anti-inflammatory medications. We're going to be using other pain-relieving medications.
Is that tablets? Is it liquid?
My plan in this case is we're going to be using an anti-inflammatory, which generally comes in a liquid form, which just gets added to his food.
Yeah.
We're then going to be using a veterinary licensed version of paracetamol.
So that's an everyday thing?
An everyday thing. The third medication, we're going to use antibodies to block a certain protein, which hopefully will reverse some of the changes that have caused him to be so painful.
If you're now blocking the pain, and the dog's running around and having a wonderful time, is that damaging the joint further?
The whole point of doing this is to make sure we've got a patient with a good quality life. The more that he rested, the less you're going to have these bones rubbing together, and it's going to slow down that arthritic process. But there's always a trade-off. Okay. So it's about balance, absolutely.
Etty is returning to the vets for her spay operation. Performed by Andy and assisted by vet nurse Alice. The surgery is a minimally invasive keyhole procedure that removes the ovaries through just 2 tiny incisions in Etty's abdomen.
Can I get light source on, please?
Andy is fully masked to maintain a sterile environment while he operates on Etty. But because this is keyhole surgery, Alice and I are removed from the action and can remain mask-free.
This operation is a spay, which is like a hysterectomy for a woman. And having her ovaries removed, as a woman, we'd get hormone treatment for that. Will Etty get it?
What we definitely see in domestic pets is we don't see any major adverse effects from a behavioural perspective.
Good.
You can see significant adverse effects if we spay them at the wrong time. So a female dog, a bitch, will very often go through a phase of something called a phantom pregnancy or a pseudo-pregnancy.
Yes.
And if there's even a remnant of that going on, we could be in a situation where a couple of things could happen. Number one, all of the mammary glands could really fill up full of milk, and that wouldn't be ideal. But at least if that happened, we can see it, and then we can give a treatment to get rid of it. What can happen if it's subclinical is that the only things you're going to see are behavioural changes. And that means that she's going to stay in the state of a phantom pregnancy, kind of hormonally, which means she'll be quite on edge, reactive towards other dogs and everything else, which is why we are very, very hot on making sure we see these patients in pre-op.
But she presented perfectly fine.
Yes.
Little dry tongue sticking out here.
Oh, bless her.
It's all right, Etty, you're going to be great.
Running down the centre of a dog's abdomen, from the sternum to the pubic bone, lies a key structure known as the linea alba, or white line.
That white line is a line of connective tissue, which means as we go through it, it doesn't bleed, it doesn't hurt, there are no nerve endings, so it's a nice way to get in there. When we do keyhole surgery, what's really important is that we've got room to operate. So what I'm going to do now is we are going to what we call insufflate. We're going to put a bunch of carbon dioxide into this abdomen and balloon it up.
Etty's abdomen is gently inflated with carbon dioxide, a safe, body-friendly gas that gives the surgical team space to work with precision, making the delicate procedure much safer.
Why did you want to be a vet?
I grew up in the Middle East, and I used to run around the desert, just obsessed with animals, and I had a nickname. I was called Mowgli. Everyone that knew me.
You're Mowgli?
I was Mowgli. That was my nickname growing up. I was just obsessed with animals. So now I'm going to stop talking because this is a critical bit.
Okay,
I need to make sure this goes in very carefully. So what I need to do is I need to make an incision big enough that I can get everything through, but small enough that it provides a degree of tension. And the thing about this procedure is you're very reliant on your ports. The port is the thing that I'm going to be sticking into the abdomen.
This small, sterile tube is used as an entry point in keyhole surgery. It allows Andy to insert a fibre optic camera, giving him a clear, detailed view inside Etty's body.
So I heard that click, which means I'm pretty much in. I'm going to have a quick look in there to make sure.
This is the camera?
This is the camera.
Right. Wow. It's rather wonderful, isn't it?
Stung by a bee. Don't judge me. It'll probably happen again.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Oh, I thought we were here about my allergies. No, it's fine. It can be about you.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Etty, a Hungarian Vizsla, is in the operating theatre.
Can I get light source on, please?
Veterinary surgeon Andy has inflated Etty's abdomen with CO2 in preparation for her spay surgery.
So that opens up the space for you?
Exactly, because otherwise there's no, I can't see anything because everything's just going to be collapsed in on it.
And dark.
And dark. And there's no room either, so I could poke something that I shouldn't poke.
Andy has inserted the ports which act as access points for the operation, allowing him to position a camera for visual guidance, along with the necessary surgical instruments.
My nemesis as a laparoscopic surgeon is the spleen. The spleen's right in your way, and if you poke it, it bleeds. There's her spleen getting in the way. Scooch around, that's the liver. That there is the diaphragm, which separates the chest cavity from the abdominal cavity.
Wow.
And you can just see beating on the other side, that's the heart.
I didn't think the diaphragm would be that translucent.
Yeah, so you've got two parts of it. So you've got the muscular part, and then you've got the ligamentous part. So that ligamentous part is translucent. And now we are going to very carefully tilt, which is why we have strapped her into the table. So right now we're going for her left ovary.
What's that bit there, a kidney?
So yeah, absolutely.
Yeah, kidney shaped.
That's the spleen. That's the
dart.
liver.
Oh,
this here is the colon, and this bit over here is the uterus.
Oh my
So it's very, very thin and long compared to a human uterus.
Now you've got 2 prongs in there. What's the bit that you're holding?
So these are called rat tooth forceps, and what you'll see, it's almost like dogs were designed to have keyhole space, because there's a little handle in there that we like to grab. We're going to be putting a stitch through the abdominal wall to hold this up and out of the way of everything important while we dissect it off. Feeling for my forceps, I know that the ovary's attached, and I'm going to be putting a stitch down, through. We're going to have a look now, see if I've caught it. Yeah, gotcha.
Well done.
Because the reality with keyhole surgery is that it's an absolutely different skill set. It's a different learning curve.
How many years in vet school do you do?
5 years.
Since graduating, Andy has spent years developing his expertise in keyhole and advanced laparoscopic procedures. With over 2,000 surgeries to his name, he's highly skilled in this minimally invasive approach.
So I've got these forceps, and these are sending an electrical current to heat up and seal the tissue. So it's making the collagen bind to itself. So I've grabbed that, and now I'm going to press this foot pedal, and we are sealing that tissue, sending an electric current through. Now I'm going to pull a trigger, which is going to send a blade through to cut it. So pull this out.
So that's almost cauterized it, really?
Absolutely. It's called vessel sealing. You hear that sound go do-do-do-do-do-do. Well, that's the sound to tell me that it's sealed. I'm going to carefully pull this out of the abdomen, trying not to drop it, otherwise I have to go hunting for it. And there it is.
The ovary.
I make sure I visualise the ovary every single time. We need to make sure we've got all of it. That there?
Goodness, yes.
That is the ovary.
It's teeny.
Teeny little thing. This is a completely inert ovary, so there's no evidence that she's anywhere close to being in season.
You right there, lady?
Like most female mammals, Etty has 2 ovaries, so Andy moves to the opposite side of the operating table to complete the spay.
That there is the ureter. So that's what takes urine from the kidney down to the urinary bladder.
Right.
And it's imperative when doing spays that that does not get damaged. Let's have a look at everything over here. You can see that major blood vessel pulsing. We don't want to mess around with that. Kidneys over there, hiding under the liver. That all looks extremely healthy.
It's like looking under a bonnet.
So what I've done is I've put this stitch through the actual ovary.
Is it just the ovaries you're going to take out? You don't go near the uterus at the same time?
No, we are just going to be removing the ovaries. We've established it's absolutely fine to only remove the ovaries rather than having to remove the whole thing, unless the uterus itself looks unhealthy, in which case you should remove it all. We're going to pull the trigger, which is going to send my blade through.
Wow, what a piece of kit that is.
It's pretty good.
Recovery after spay surgery is usually straightforward. And with keyhole procedures, it's even quicker, with most dogs back on their paws after just a few days of rest.
Because the incisions are so small, the chances of the stitches splitting and there being a major issue is so low. My patients are generally doing 40 minutes off the leads worth of exercise within 5 to 6 days post-operatively. Now we just need to close up these little holes. Stitching that small incision can sometimes be, for me, the most frustrating part of the procedure.
So she's still looking good, Alice?
Still looking good.
This is an easy one. Right there for me. So
Got it?
Got the muscle wall there. So we're going to put stitch through one side. So this was a beautiful surgery to do because she's so well cared for.
We treasure our animals.
Absolutely.
Etty was taken in by her owners as a pup, but not all animals have such a smooth start to life. Across the UK, hundreds of rescue centres are working tirelessly to give dogs a second chance. From large national charities to small local shelters, an estimated 110,000 dogs are rehomed every year, each with a story and all hoping for a fresh start. And this local rehoming charity is making a big difference to dogs' lives. Jerry Watkins and the team at Bristol Dog Action Welfare Group, or DOG, offer sanctuary to dogs without homes across the UK.
Our mission is to rescue as many greyhounds and lurchers as we can Every year, we rehome between 75 and 100 dogs. There's an absolute abundance of greyhounds looking for rescue from both the racing and the coursing industry.
Come on, darling. There's a good girl. You're a little bit timid, aren't you?
The dogs which we get arrive from Ireland in the middle of the night. They don't look the tidiest. Their coats look a bit raggy and a bit untidy, and they could do with a really good brush. We then bring them to the rescue. They may have had a rough start in life, but things are about to get a whole lot better.
Oh, bless. Oh.
We keep all the greyhounds which arrive initially for a 2-week assessment period. So we can assess their suitability, what sort of homes they're ready to go to. We make sure that they've got no medical issues. We spend time with them. The dogs get lots of attention. They get brushed, they get fed well.
As kennel supervisor, Nina Atwood oversees the welfare of every dog from the moment they arrive at the rescue centre, making sure that they receive the medical care they need to be fit and healthy for their new lives.
The best thing about my job is definitely the dogs. They are completely built for speed, so they got a big long tail, which is like a rudder for when they go around the corners. They've got a different heart to a normal dog because they go so fast, so quickly. All the blood goes to the left ventricle, so it's bigger because otherwise they'd pass out. Everyone's under the preconception that they take masses and masses of exercise, but they're quite happy with little 2 20-minute walks a day.
These dogs have spent 2, possibly 3 years in kennels. Come on then, there's a good boy. The human connection is what they value when they get here because it's something that most of them haven't had before. Come on then, good boy. Good lad, come on then. Ben is from Racing Kennels. He's only 2 years old. He's got such a gentle nature and a lovely, lovely temperament. When Ben first arrived, he was a little bit underweight. We've had him now just over 2 weeks, and he's already put on 1 kilo. He's now ready for rehoming. We have about 60 to 70 volunteers who we couldn't manage without.
Spencer, out. Good boy.
Nigel Stevens has been a dedicated volunteer at the rescue centre for the past 3 years.
Greyhounds are special. They have got the most beautiful souls ever. I first started volunteering here because my greyhound died and my wife saw that I was missing her. Stop. My Labradors, Penny and Lila, help to socialise the greyhounds here. A majority of our dogs come from the racing industry. It's likely that they have never met a different breed than a greyhound. We're going to be working with Ben today. Ben came over from Ireland about 2 weeks ago.
Can I say hi? Good boy.
I'm going to bring him in here with a muzzle just for his own safety, not because he's dangerous.
Good boy. Can I come and see? Come on then. Hello. Sam, good boy. Good boy. We walked Ben around the paddock to see how he interacted with the dogs. Body language was really good. He was really chilled. Good boy, Ben. Good boy.
Ben is a very even-tempered dog. When he came in, he didn't seem at all bothered by the Labradors.
Perfect. Well done. Ben's reaction today with the pack was absolutely amazing. 10 out of 10 from him. I love him.
I am always a great believer that the dog picks their owners. I just feel very, very emotional when a dog does go. Every dog that leaves us, we've given a second shot at life. It's just a wonderful feeling to see those dogs go off to new homes and new families. Come on in, let's go.
Coming up, we find out how Bailey, the lovable Labrador with a painful limp, is getting on. Bailey! And meet the ex-racer, setting her sights on a new career.
You can go and train to be a therapy dog.
Uh-oh. Vet bills. Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Uh-oh. Vet bills? Don't worry, Dad. I'll eat them. Ha ha. See you later.
Fern Britain Inside the Vets, brought to you by Pet Plan Insurance.
Flossie, a rescue greyhound, has come a long way since her days on the track. Today, she's going back to Grove Vets with her new owner, Molly Rose.
Right, come on in. Here they are. Hi.
To meet vet James for a follow-up routine vaccination.
Ooh, 2 of them. Nice to see you. Who have we got here?
So we have Flossie here, she's an Irish greyhound, and Remy.
And he's a whippet.
He's a whippet.
And then Flossie here, greyhound, obviously.
Irish greyhound, yes.
And they're good friends.
We had Remy for like 9 years before we got Floss. Remy tolerated her at the beginning, was very patient. Flossie is a rescued racer. She had no idea about manners, toys, she didn't know how to play. She didn't know how to run for fun, and she learned all of it from Remy. Like, he was a wonderful teacher. So she loves him. He handles it.
Each year, thousands of people across the UK welcome rescue dogs into their lives. Not just for companionship, but also to give an animal in need a second chance.
My husband and I had always liked the idea of having a second dog. Being able to do something small like adopting a greyhound, it made me remember actually there are little things that we can do that can make a difference. Flossie has changed a lot since we adopted her. She needed a lot of TLC. She was very timid before, she was very jumpy at loud noises, and now she is an absolute queen.
Remy, yes, I know you've been a very good boy, but it's not about you, is it? It's all about your mate here, Flossie. This is her appointment. What are you going to do, James?
So Flossie's come down for her second vaccination.
Second
hasn't she?
vaccination,
Brilliant.
yes.
So we did her first vaccination about 4 weeks ago to get her immunity levels boosted back up to speed.
So how old is she?
She is 6.
6,
Yeah.
but she hasn't had any injections before?
She was vaccinated when we got her, and she came with her pet passport and all her jabs, but we needed to get them up to date because I want to register as a therapy dog. And so to register as a therapy dog, you have to have vaccinations all up to date.
And she's fitting well in herself, you're happy?
Yeah, she's all good.
How was she for the first vaccination? Did she yelp or was
No,
she...
she was absolutely
Ah,
fine.
good.
She is a strong Irish lass.
Yeah.
Like, she's very stoic.
You say she's rescued. Where did you rescue her from?
I was volunteering at a local greyhound charity, and I just remember Flossie, she looked up at me from the kennel, and she was really quiet and very still, and I felt really affected by it.
Fascinating that she spoke to you and you heard her. There's a proper communication with animals, isn't it?
100%, and I think the rescue story is so beautiful, you know, because rescue dogs, they do kind of carry this stigma that they're either broken dogs or there's something wrong with them. Or troubled, and often they are in rescue centres through absolutely no fault of their own. So I think that journey and that relationship can just be so special.
Well, you carry on with this second.
we are
This is the
ready.
important one, darling. Once you've got this in you, you can go and train to be a
therapy dog.
So, should we do the vaccination?
Let's do it, Flossie.
I'm going to inject into her neck back here. Are you happy to have a little hold of the collar for me? Just a little.
Good girl, Floss. Good girl, Flossie.
Good girl.
Good girl, Flossie.
Flossie, congratulations. Well done. And I'm expecting to hear good things from you, all right?
Yes.
Flossie has found comfort, care, and a family to call her own. But second chances aren't just for dogs. This well-travelled rescue cat has recently arrived in Bristol. She's been brought in by her new owner, Imogen.
Hi.
Hi.
How are you doing?
I'm fine, thanks. How are you?
Very well, thank you.
For a follow-up with James to check a wound that reopened after spay surgery, performed shortly before her adoption journey to the UK.
Right. How are we doing then?
She's settling in very well.
Good. Hello. Now, last time I saw you, we didn't have a name, did we? Have we got the name sorted?
Buffy.
Buffy! Oh, I love it. The Slayer.
Buffy the Vampire Slayer.
Hi, Buffy. I love what you said, that we have to wait until you kind of got to know her personality.
Yes.
especially with rescues, I think, because they are their own little characters, aren't they?
Yes.
Good girl.
Buffy's personality is very sweet. She purrs the second that you touch her. There are a lot of cat rescue groups in the Middle East who really want to rehome their cats in the UK because they know that we're such a nation of pet lovers. She was flown over from Abu Dhabi to Heathrow, and then somebody couriered her to Bristol. Quite strange to just have a little cat from the Middle East suddenly appear at my doorstep, but very lovely. The thing that I love most about my cats is that they are really calming and soothing whenever I feel overwhelmed or stressed. I was diagnosed with autism when I was 21. The world isn't built for autistic people or neurodivergent people, so we have to have different ways to cope. And for me, the way that I do that is coming home to my cats and having a cuddle with them. Buffy is very special to me. I had Buffy for 3 days before I noticed that her spay wound had opened. I checked with her fosterer in Abu Dhabi and she said that she'd only been spayed a few weeks before. We took her in for an emergency appointment the next day. James put 3 staples in her with the help of Amy. Thankfully, they were able to see me quickly because I was quite concerned.
And obviously what we're looking at today is how these staples might have helped. This was the surgery done by the rescue centre abroad, wasn't it? And we just had the wound open up slightly. Hopefully those staples have brought it back together. Has she been leaving them alone?
She doesn't seem to have noticed them at all, to be honest.
Great. She does look like she's left that alone beautifully, actually. Let's take those staples out staple. What we'll do is one by one, and we'll just sort of make sure that the wound is genuinely held together.
You're being very brave at the doctors, aren't you?
Okay, would you be happy to almost sort of hold her with her belly facing me?
Sure.
And then I can
We can
go down the line and see. Okay. Okie dokes. Right, let's have a look. That's brilliant. That looks good. Right, that's one out. We'll just do the next.
It's okay, little sausage. It's okay.
Third one. Beautiful. And that's number 3.
Well done.
And that has held really nicely. So that's great. That saved us having to do any further surgery there. So the skin's knitted together really well. The muscle underneath feels absolutely fine. She's so chill, isn't she? Considering everything she's been through. So that's us all done with Buffy. So this is the bit she's not quite so keen on, is it? What do you think? Do you want to go back in your little basket? Oh. There we go.
Oh, what a good
They
girl.
often know, don't they? They never want to get in the basket at home, but they always know when they're at the vets.
It's
Get back in. Yeah, exactly. I'm really pleased about that.
Perfect. Thank
Great.
you so much.
No worries.
Back at home, one much-loved patient has been following his recovery plan.
Labradors on the whole don't show pain. They won't yelp. They will be very stoical about the whole thing.
Previously, Bailey was limping, his right leg causing him pain.
When we went to the vets, the first thing they suggested we do is to find out exactly what's happening, get a baseline. And to do that, they were going to x-ray the right leg.
3 weeks later, we're back with Bailey and his owner, Claire.
Bailey!
To see how he's been getting on, from joint supplements and slower walks to carefully managed medication.
Boys!
But has it all been enough to help Bailey feel more comfortable and bring back some spring in his step?
When the x-ray came back, they found that he has arthritis. He's never going to not have arthritis, but we can manage it. We are injecting him once a month for 3 months. For the chronic arthritis, we give him anti-inflammatories every day with his evening meal. Already, it's made a significant improvement, and we've only had 1 injection. I'm hoping that this improvement will continue over the next 3 months, and then maybe you won't need to have those injections again. There is such an improvement in Bailey's daily life. You feel you've done your job as a dog owner. It's so nice to see that he now wants to run and he wants to play, because he didn't for a time. You just want them to have a full standard of life, and that means going out for walks, running, playing with other dogs, playing with his brother. Their happy place is when they're together. It also makes my job as a dog owner very easy, because there's a lot of exercise going on there which I don't actually have to instigate. When I went to the vet, whatever the vet said, we were going to do that. That's what matters, and it's worth every penny. We are a nation of pet lovers. If you enjoy your pet, it adds an awful lot to your life. Not just a companion in the house, but the reason to get out on a cold, wet, rainy day. Good for all our mental health. Good boys. What does the future hold for Bailey? Well, it's got a couple of weeks in Cornwall coming up soon, so we'll be doing a lot of swimming. Hopefully another good 4 or 5 years of a really lovely life. I adore that dog. Absolutely. Bailey is my dog.
Next time, all is calm at the vets as I'm given a front row seat in the operating theatre.
He's not in any distress. He probably
No,
doesn't
he's
even
fast
know what's
asleep.
happening.
He's a bit snore. He's just having a nice little snore.
And Barney, a Macedonian rescue dog, goes under James's knife.
He's nice and relaxed, my end, which is exactly what we need.
Hayallerimde dolaşırsın. Uzak olsa da yollar, kalbim sana akar. Ama yine sen varsın. Hayallerimde dolaşırsın. Uzak olsa da yollar, kalbim sana akar. Sanki bir düş gibi her an seni yaşıyorum. Gözlerimde ışığın geceyi aydınlatıyor. Ama yine sen varsın. Hayallerimde dolaşırsın. Uzak olsa da yollar, kalbim sana akar. Ama yine sen varsın de dolaşırsın. Uzak olsa da yollar, kalbim sana akar.
Great. She does look like she's left that alone beautifully, actually. Let's take those staples out today, but what we'll do is one by one, and we'll just sort of make sure that the wound is genuinely held together.
You're being very brave at the doctors, aren't you?
Okay, would you be happy to almost sort of hold her with her belly facing me?
Sure.
And then I can go down the line and see. Okay, right, let's have a look. That's brilliant. That looks good. Right, that's one out. We'll just do the next.
It's okay, little sausage. It's okay.
Third one. Beautiful. And that's number 3.
Well done.
And that has held really nicely. So that's great. That's saved us having to do any further surgery there. So the skin's knitted together really well. The muscle underneath feels absolutely fine. She's so chill, isn't she? Considering everything she's been through. So that's us all done with Buffy. So this is the bit she's not quite so keen on, is it? What do you think? Do you want to go back in your little basket? Oh. There we go.
Oh, what a good
They
girl.
often know, don't they? They never want to get in the basket at home, but they always know when they're at the vets.
It's
You get back
over.
in. Yeah, exactly. I'm really pleased about that.
Perfect. Thank
Great.
you so much.
No worries.
Back at home, one much-loved patient has been following his recovery plan.
Labradors on the whole don't show pain. They won't yelp. They will be very stoical about the whole thing.
Previously, Bailey was limping, his right leg causing him pain.
When we went to the vets, the first thing they suggested we do is to find out exactly what's happening, get a baseline. And to do that, they were going to x-ray the right leg.
3 weeks later, we're back with Bailey and his owner, Claire.
Bailey!
To see how he's been getting on, from joint supplements and slower walks to carefully managed medication.
Boys!
But has it all been enough to help Bailey feel more comfortable and bring back some spring in his step?
When the x-ray came back, they found that he has arthritis. He's never going to not have arthritis, but we can manage it. We are injecting him once a month for 3 months. For the chronic arthritis, we give him anti-inflammatories every day with his evening meal. Already, it's made a significant improvement, and we've only had 1 injection. I'm hoping that this improvement will continue over the next 3 months, and then maybe you won't need to have those injections again. There is such an improvement in Bailey's daily life. You feel you've done your job as a dog owner. It's so nice to see that he now wants to run and he wants to play, because he didn't for a time. You just want them to have a full standard of life, and that means going out for walks, running, playing with other dogs, playing with his brother. Their happy place is when they're together. It also makes my job as a dog owner very easy, because there's a lot of exercise going on there which I don't actually have to instigate. When I went to the vet, whatever the vet said, we were going to do that. That's what matters, and it's worth every penny. We are a nation of pet lovers. If you enjoy your pet, it adds an awful lot to your life. Not just a companion in the house, but the reason to get out on a cold, wet, rainy day. Good for all our mental health. Good boys. What does the future hold for Bailey? Well, he's got a couple of weeks in Cornwall coming up soon, so we're doing a lot of swimming. Hopefully another good 4 or 5 years of a really lovely life. I adore that dog. Absolutely. Bailey is my dog.
Next time, all is calm at the vets as I'm given a front row seat in the operating theatre.
He's not in any distress. He probably
No,
doesn't
he's
even
fast
know what's
asleep.
happening.
He's a bit snore. He's just having a nice little snore.
And Barney, a Macedonian rescue dog, goes under James's knife.
He's nice and relaxed, my end, which is exactly what we need.